Hello everyone, welcome to this video. In this video, we are going to learn about the non-communicable disease. Why it is in news? Because recently, Ministry of Family Health and Family Welfare released a strategic operational guidelines for the National Program for the Prevention and Control of the Non-Communicable Disease for the management of NCDs. Okay, so in order to understand the non-communicable disease and the recent program, we are going to approach this issue in the phase wise manner. In the very first phase, we'll understand what are the changes brought by this guideline. Then we'll move to the next part where we are going to understand the communicable disease and non-communicable disease. What are the difference between the two? Then we are going to understand how it is affecting our country and what are the its effect on the GDP. Okay, so first and foremost, let's move to the strategy operation guidelines. So what it did. So the highlights of this guidelines is first that it talk about the focus on the primary and secondary prevention and clinical support for the NCDs, because recently why the obesity is increasing, why the non-communicable disease diabetes is increasing. It is because of the inefficient primary and secondary prevention prevention system. Okay, and the second one is it renamed the NPCDCS to the NPCD, that is National Program for the Prevention of Cardiovascular Diabetes, uh, cardiovascular diabetes, cancer, and stroke. Okay, National Program for the Prevention of cardiovascular, okay, and diabetes and stroke. Okay, so recently it is renamed as the NCD, and it also widened its ambit by including the various other disease in it as well as chronic obstructive pulmonary disease, asthma, and non-alcoholic fatty liver disease, and PM National Dialysis Program. So these programs are now part of this scheme as well. And it also talk about the comprehensive uh, primary health care that is turned into the national NCD portal. There is a portal to file the report or to check the status of it. Okay, so it was renamed into the national NCD portal, which was earlier the comprehensive primary health care, non NCDs. Okay, now what are the challenges related to the NCDs in India? So before moving to the challenge, let's understand the NCDs. What are NCDs? Okay, so non-communicable disease are those disease, okay, be which cannot be caused by any pathogens. It is due to the lifestyle. And when it comes to differentiate the non-communicable disease, there are two types. First, the major four diseases of the non-communicable. So these four diseases are the cardiovascular, cancer, chronic respiratory disease, and diabetes. These are the four main non-communicable disease. Whereas the other disease are the hypertension, dyslipidemia, obesity, metabolic syndrome, rheumatoid arthritis, okay, depression, cognitive impairment, neurodegenerative disease. So these all are the minor disease. Actually, these are not minor disease, but in compared to these four main giant disease, it is minor one. Then, what are the factors that lead to the NCTs? So, first and foremost, the behavior and risk factor. Due to the hectic cycle or the our schedule, the obesity is increasing. We are not immune to disease. We are more prone to this disease right now because there is a lack of physical activities, use of the tobacco and other intoxicants like alcohol, blood pressure is increasing, and cholesterol problem due to the smoking and the unhealthy junk food, and due to the high calorie foods and blood glucose due to the stressful life and less sleep. So these are the factors that lead to the non-communicable disease. Now we are going to understand what are the challenges associated with the non-communicable disease in India. So first and foremost, there is a lack of trained resources. We have a we have a population of 140 crore, and right now we have not even calculated the right figure related to the NCDs. And most of the people who are obese, they do not go to primary and secondary healthcare system to understand how it is going to affect them in the longer duration. And then low budget allocation and the utilization. Now it's your work to tell me that how many percentage of GDP is allocated for the healthcare, and how many percentage of the budget is allocated for the, when it comes to GDP, first you need to understand about the budget. Okay, how many percentage of the budget is for dedicated for the NCDs, and for the, because recently we came up with the different thing, that is the outcome budgeting. Okay, where we talk about these things as well. So now it's your talk. Now it's your work is to tell me. Third one is a poor implementation of the schemes. We have a wonderful schemes like Fit India. Okay, Eat Right by the FSSAI, but there is a poor implementation in the ground level, and there is a poor adherence to the medications given by the health experts, because an aware citizenry is a must to fight these kind of disease. Now we are going to discuss, as I told you, there are two type of disease. First one is a major cancer, cardiovascular disease, cancer, chronic respiratory disease, and diabetes. Then there are others that is known as the minor disease. I already told you about this. Now we are going to understand what are the initiatives that government started. So first and foremost, they started the National Program for the Prevention and Control of the Cancer, Diabetes, CVD, and Stroke. I already told you it is renamed as the NPNCDs. Okay, and there is a National Action Plan. It works under the Ministry of the Family, Health, Family and Family Welfare plus WHO. There is a goal of the WHO. I think you know about that goal. 1 million, 1 billion more people. Okay, so there is an initiative by the WHO regarding the NCD. So our this national action plan is in line with this WHO plan. Then there is an initiative of the Ayushman Bharat Health Wellness Center. Okay, it is more about the preventive healthcare system. Okay, or the than the curative one. Then there is a scheme for the healthy diet, promotional schemes, or to promote the healthy diet in our food. Okay, where we can consume the good food that which has good nutrition value, just like the food, just like the millets, and many other foods that have the good nutrition value. And we can use the rice fortification as well. Okay, there is a iron fortification in the rice, and there is a Fit India movement. Okay, for the behavioral change, or to make the fitness as a part, or a physical activity as a part and parcel of our life. And then there is a outcome based budgeting that I told you in the earlier phases. Okay, so this is about the non-communicable disease I told you about. So let's revise this topic. First, I told you that Ministry of Health and Family were released a strategic operation guidelines for the NPNCDs. What actually happened in it? The whole intention of this document is to focus on the NCD at the primary and secondary center. Okay, and the main highlights is to widen the ambit by the including different things. Okay, and there are, then we move to the challenges. What are the challenges associated with it? What are the initiative by the government? uh, we are left with this part, so that we are going to learn in this way, that how non-communicable disease are different from the communicable disease. So we are going to understand this non-communicable and communicable disease in this framework. First, when it comes to the non-communicable disease, the cause of non-communicable disease are allergies, malnutrition, illness brought by the internal factors due to our lifestyle changes, whereas the communicable disease are prone to the infections or a pathogens. It is caused by the pathogens. Okay, whereas when it comes to the transmitting agent, in case of the communicable disease, it is a virus, bacteria, protozoa. But when it comes to the non-communicable, it is about the lifestyle, or it's a changes in our patterns. When it comes to the inheritance, the communicable disease cannot be passed on from the one generation to the another, whereas the non-communicable disease, just like the hypertension, obesity, it can be transferred from one generation to other generation. Diabetes. Okay, uh, when it comes to disease type, it can develop immediately and is acute, but when it comes to NCD, it develops over a period of time and it is a fatal, and it lasts longer. When it comes to the treatment, traditional treatment may work in the communicable disease, whereas in the case of non-communicable disease, we need a surgically or the specialized treatment. When it comes to example of these, I already told you tuberculosis, malaria, these all are the communicable disease, even including COVID. Whereas the Alzheimer, hypertension, asthma, cancer, these all are the non-communicable disease. So this is